So, apart from the TMN classification of breast cancer, that's into tumor, nodular, and M for metastasis classification of breast cancer. There's another classification of breast cancer known as the what Manchester system classification of what breast cancer. Okay, so this Manchester system classification of breast cancer, we'll be looking at the overview, how this classification is done, and each of the what classes, what does it mean to actually have a type of breast cancer under here. All right, so moving, we'll define it. We'll talk about the basis of this classification. We'll talk about a breakdown, right? Breakdown of this classification. We'll end by talking about the scores, right? So if you access a tumor, the tumors you have different scores, right? So you add the scores. The score is between 0 to 3. What does it mean? 3 to 5, what does it mean? And like that, right? So Manchester classification, also known as what? Manchester system, or the Manchester scoring system, is a method which is used to predict the likelihood of axillary lymph node involvement in breast cancer. All right, so the chief thing that we're basically trying to look at is what? Axillary lymph node. Is there axillary lymph node involved? Is there axillary lymph node involved? This is the question you're basically trying to ask. Okay, so it is based on a scoring system that takes into account several factors like what? The size of the tumor, that's tumor size, tumor grade, looking at the lymphovascular invasion, that's involvement of what? Lymph nodes and blood vessels. They're also looking at the estrogen receptor status, that's what? ER status. They are looking at the lymph node size and location too, right? So now the Manchester classification assign points. They are basically looking at points. Does this tumor have this? Does this tumor have this? Does this tumor have this? For each of the questions you're asking about the tumor, you are giving a point. Okay, you finish and you add the point. Okay, so it gives out points for each of these factors. These are the factors. Okay, so it gives out points for this, and the total score is used to predict the likelihood of axillary lymph node involvement. The score will range from 0 to 12, with higher scores indicating a higher likelihood of lymph node involvement. All right, so here is a breakdown of the Manchester classification scoring system based on tumor size. If the tumor size is less than 1 centimeters, then the point is 0. Okay, the tumor size is between 1 to 2 centimeters, the point is 1. Right, the tumor size is between what? 2 centimeters, the point is 2. Right, that's based on tumor size. Then I'm going to tumor grade now. Right, grade 1 are basically what? Low grade, so you give a 0 point. Grade 2 are the intermediate grade, you give a 1 point. Grade 3 are the high grade, you give a 2 point for that. Right, and based on what? Lymphovascular invasion. This one is basically if it is present or not. Right, are the lymph nodes and blood vessels involved in what? That tumor. If they are absent, you give a 0 point. If they are involved, you give a 1 point. Then talking about the estrogen receptor status. If the estrogen receptor status is positive, you give a 0 point. If the estrogen receptor status is negative, you give a 1 point. Right? Then lymph node size and location. If you have a normal looking lymph nodes, right? If the lymph nodes around that area are normally looking, they have a 0 point. If you have abnormal lymph nodes, which are enlarged or extranodular extension, you have between 1 to 2 points for that. And the total score, that's if you ask each of these questions about any tumor you come across, you give points. After you finish, you add the point. Now we're basically talking about the total now. The total score is then used to predict the likelihood of axillary lymph node involvement. All right. So if you have a score that is between 0 to 3, so that is a low risk cancer. Right. Now there's less than 20% chance of the lymph node being involved. Okay. Then if you have a score between 4 to 6, that's a moderate risk cancer. There's a 20 to 50% chance of what? Lymph node involvement. If you have a score that is between what? 7 to 12, it is high risk. There's 50% chance of what? lymph node involvement, right? So on that basis, this is a Manchester classification of breast cancer. So that's it. Bye for now.